Okay, so hello everyone, and my name is Heather Butts, and this session is going to be on public health, law, and ethics during COVID-19. So first, a little bit about who I am. So my name is Heather Butts. I received my undergraduate degree at Princeton University, my law degree at St. John's University School of Law, where I focused on Medicare, Medicaid, and healthcare generally. From there, I went to Harvard University and I received my public health degree in law and public health. So that gives me, I guess, a little bit of bona fides to talk to you about this. And then I received my teaching degree in psychology and education and adolescent psychology, and also, actually, interestingly enough, online education and media from Columbia University. I worked at Health and Human Services in the Shalala administration, in the Office of the Secretary under the Office of the President. And from there, I worked at PricewaterhouseCoopers as a healthcare consultant and healthcare compliance consultant. And then I worked for several years as an administrator at Columbia University Medical Center, doing patient advocacy for people in clinical trials and research studies. And then from there, I transitioned to my current life, which is teaching. So I'm a public health law professor, and I teach at Long Island University. I also teach at Columbia University and at St. John's University School of Law. And many of you on the call probably know me because of my nonprofit work. So I work and I founded a nonprofit called Health for Youths. And we work with underserved young people throughout New York City. And we do a lot of work around college readiness and healthcare and basically getting them ready for this lovely thing called life. So that is a bit about me. So I think what we will first do is define some terms, because I hear lots of terms floating out there and people sort of conflate terms. And so I think the first thing to do is just to get some definitions going, okay? So first, what is a virus? Okay, so a virus is it's a biological agent. So it reproduces inside of a cell, which is inside of a living host. Basically, a virus is something that just keeps replicating. So it invades a whole cell and then it produces thousands of copies of itself. And that's how people get sick, because you get a virus and then it reproduces, it makes lots and lots and lots and lots and lots of itself. And unfortunately, that is how people get ill. So that's what a virus is. What is COVID-19? By the way, COVID is essentially a phraseology. It's stands for the CO. I don't know if people know this. The CO stands for corona. The VI stands for virus. The D stands for disease. And that's how we have COVID-19. So COVID-19 is also it's a coronavirus. And uh, when we think about how people are being tested, for example, I guess maybe people think that there's this special COVID-19 test that's running around. I mean, basically, what people are being tested for is a coronavirus. And coronaviruses has been with us for a very long time. There's lots of them. This one just happens to be unique and novel in that it was first identified in Wuhan, China, and it is believed that it passed from animal to a human and then eventually jumped from going from people to people. And I can't overemphasize this in our talk today. I guess people think that things like diseases and, you know, things like a virus or bacteria, they are static, as in they don't change. But the whole point about a virus is that it mutates. So this might be a little lost on people who are younger, but in my day, we had something called carbon copy. And I don't mean carbon copy in the sense of a BCC on an email. I mean, carbon copy is actually a little sheet of paper, and you used to put it between two pieces of paper. And it was the way that it was basically sort of the old-timey version of a Xerox machine. But if anybody remembers carbon copies, the thing about them is that they're not exact replicas. So when you did a carbon copy and you had the other side of it, if you looked at it, you said to yourself, well, it looks pretty similar, but it's not exactly the same thing as the original. Well, that's exactly what happens when you get a virus. It essentially is a carbon copy. So it kind of looks like what it looked like in the other person, but there's differences and there's mutations and there's changes. And so when you that happens with hundreds and thousands and millions of people, it's going to look a lot different. It's sort of like the game telephone, where it started with one person, but by the time you get to the last person, it could look significantly different. So that's why, if you're frustrated about the fact that you feel that healthcare professionals aren't giving you exact information and you don't know what's going on and you're very confused, well, that's because it can be kind of confusing. And healthcare professionals, and put myself in that bucket, it's an ever-changing environment. And so what COVID-19 looked like 3 months ago in Wuhan, China, is very different than what it looks like now. And so it's a process. And so when we also think about why is it hard to come up with a vaccination for something like COVID-19, that's one of the reasons. So just keep that in mind as we go along, because some of the answers will be, it's unclear. And so we kind of all have to be mindful of that and be ever vigilant in terms of the information that we're getting and disseminating. All right, so we talked a little bit about what a virus is and what COVID-19 is. This is what it looks like. You've probably seen this image before. This is actually COVID-19. Social distancing. So this is a term that we hear a lot, right? You got to social distance. Get away from people. 6 feet or more. But what is social distancing? So this is a great, and at the end, I'm going to have a series of resources for you. So I hope they'll be helpful. So social distancing. So social distancing is a public health practice. And the point of it is to prevent sick people from coming into close contact with healthy people. And why do we want to do that? Because we want to reduce opportunities for disease transmission. Now, you probably heard a lot about different localities canceling events with 500 people or 250 people. I know Staten Island, it's down around 100 people. So you might be thinking to yourself, well, okay, well, why? Well, a big reason is because social distancing helps us in terms of making sure we can actually have distance between people. If you're somewhere with 50,000 people, well, it's hard to maintain distance between you and them because there's a lot of people there. So the less people you have at an event, the easier it is to actually create social distance. Obviously, one of the concerns of social distancing is stigmatizing people. So the concern is that, okay, well, I want a social distance and I want to stay away from you and you and you and you. And yet, after a while, why are we social distancing if that creates a stigma, but the person isn't actually ill? So those are one of the things we have to avoid, right? And one of the webinars I'm thinking about us doing is coronavirus, the aftermath. What do we do once this is all over? But we have a lot of these sort of social stigma issues that we're going to have to deal with. So we're going to talk about that a little bit. But that is what social distancing is. And why is it important? We talked about this a little bit. It slows down outbreaks, reduces chances of infection, you reduce burdens to the healthcare system, and it flattens the curve. You probably heard that term a lot, right? So we're going to talk a little bit about what that means and what that looks like. But essentially, you can prevent surges in something like COVID-19 that would be difficult for the healthcare system to absorb. What does that look like? All right, so here's what flattening the curve looks like. So essentially, what healthcare officials, and this is gets more into the area that I focus on. So my research and my area have to do with public health, epidemiology, and law. And I've written a couple of books that look at this in Civil War times. So you'll hear me refer to issues such as outbreaks and epidemics and pandemics from a historical perspective, because that's my orientation and that's what I'm interested in. That's what my focus has been. And this is not new to us in terms of thinking about some of the historical issues that we are now facing in real time. And so when we talk about flattening the curve, one of the real concerns with respect to COVID-19 is that there will essentially be uncontrolled transmission. So the number of cases will spike in a way that the healthcare system cannot absorb it. And if any of you have been in an ER in the last decade or two, you probably have noticed or noted that when you go to an ER, they're pretty packed, right? So you walk in and you see people that are in the hallways in terms of on gurneys, and it just feels as though there's a lot of people there. Well, you might be onto something. So the healthcare system is already decently taxed. And oftentimes when we go to an ER and we are there for a while and we need to be admitted and we can't, a lot of that is because there may not be enough beds to admit people. So that's concerning. And so the flattening the curve, the many reasons we want to do that, it is to protect the healthcare system, which again, that's an area that I actually focus on and I study, particularly healthcare systems, because when we think about what the definition of healthcare is and what we perceive to be healthcare, the healthcare system is an important part of that. So that's one of the reasons why we want to do things like social distancing, like controlling measures, like making sure that people are tested and we know who is ill. Because if the system is burdened, then those who are very ill will not be able to be treated. And then we're going to have a bigger crisis on our hands. So that's what we mean by that term. All right, so I thought we'd continue with some of these definitions. I hear this is the one, this is probably my pet peeve, just because I'm a public health nerd. Quarantine versus isolation. I cringe a little bit when I hear people using these terms interchangeably because they're completely different. So a quarantine actually restricts the movement of people exposed to a contagious disease. So if you are told to be under some sort of a quarantine, you are not exhibiting signs of the illness yet. You may have been exposed to somebody, you may live with somebody who has a disease, you may have even been in close contact with somebody who has a disease, but you yourself are not exhibiting the symptoms. And so when people are told it's 14 days you need to be away from society, that is a quarantine. That is a very different thing than isolation. So if you are ill, you are sick, you have been diagnosed with coronavirus, you are no longer in the quarantine bucket anymore. You have transitioned to what is called isolation. And isolation is when you are ill and you have to be removed from society, and you have to be. This is no longer voluntary for you. You can no longer sort of bargain with the system to talk about what this is going to look like. You now have to be isolated, and that usually means certain measures that will be in place for you that have to be strictly adhered to. So that's the difference between those two. Myths, and there are a lot of them. So one is, oh, it's summer's coming, so I don't have to worry about coronavirus. We don't know that. That's unclear. Another one, if I wear a mask, I will be safe. That's not true. And one of the most prevalent ways that people are getting coronavirus is through handshaking, shaking people's hands. Only older people are getting it. This is horrific. Boomer remover. I don't know if anybody's been on Twitter lately, but apparently that's a new term for Generation Z. Boomer remover, to remove people from society who have coronavirus and who are older. Yeah, younger people can get it, and especially if you're immunocompromised, you certainly can get that disease. So please keep that in mind. And there are other myths which we can talk about, and we'll talk about on a future webinar. Okay, so we'll get to that at the end. If people don't agree with compulsory isolation, what, if anything, can the government do? Government can do lots of things. It can make sure that you stay at home. There's a case I'm going to talk about in a bit, and I'm going to try to move through the rest of this kind of swiftly to take some questions, because I want to get in our sort of under half an hour a bit. But basically, you can very much be compelled by the government to isolate. And that is because government state officials do not want you to be able to spread the disease. And if you can't do that willingly, the government can compel you to do that. Compulsory isolation. Infectious versus contagious diseases. So infectious diseases are diseases that can be transmitted to human beings by means of a virus, and it must actually infect the person. Contagious diseases are transferred from one person to another. And again, that's why COVID-19, from a public health perspective, is decently fascinating, because that is a realm that we're in now with it. It jumped at some point, and now it obviously can be spread from one person to another. Outbreaks, epidemics, and pandemics. Everybody got very anxious when the World Health Organization declared COVID-19 a pandemic. I mean, I've been calling it a pandemic for a while, and probably the World Health Organization internally has too. But an outbreak basically is you see an uptick in diseases. It's usually localized, and you see higher rates than normal. Obviously, for COVID-19, we're seeing higher rates because it's new, it's novel. An epidemic is a broader outbreak in a larger geographic area. So, I mean, an epidemic, I would say, is more sort of between an outbreak and epidemic was probably what we saw with measles in Williamsburg. And I would call that an epidemic, but you could probably get away with calling that an outbreak. We're in pandemic land, right? Multiple countries, think global. Pretty much every continent is being impacted by this. It's worldwide. So that's where we are with respect to this currently. Cases, and again, this map is from yesterday. It's outdated already. So, and I'm gonna, again, I have some great resources at the end for you that I hope you found helpful and useful. But this gives you an idea of where we are with respect to COVID-19 worldwide. It's everywhere. So that makes it a pandemic. How does COVID-19 spread? And some of this information you've probably heard so much that you're just sick of it. But basically, sneezes, coughs, droplets. This information is changing on a regular basis. So, I don't want to be too much of an alarmist, but there's some interesting new studies, especially from some Princeton researchers, about how long COVID-19 actually lives in the air. And so I would highly recommend that you put a marker with some of these resources, because the changes are happening minute by minute. Symptoms: fever, cough, shortness of breath. And I've given you another resource that tells you about additional symptoms that you should be looking out for. How can individuals protect themselves and others? Avoid close contact with sick people, which means people need to help each other out with that. Avoid touching your face with unwashed hands. Clean objects and surfaces frequently. If you are sick, stay at home, which is going to become less and less of an issue for most of us as we shut down systems, but you need to stay at home and cover your nose and mouth when you sneeze or you cough. I'm going to spend just a minute or two talking about the public health and ethical issues, and then maybe take a question or two. So what do we have to as a historical perspective? The 1918 flu, my friends. And again, one hopes that we don't get here, but the 1918 flu, and I guess people are unaware of this, that was an H1N1 virus. And it was worldwide, and it impacted about a third of the world's population became infected. So 500 million people at the time, and 50 million people died. There are 675,000 deaths in the United States alone. We can avoid 1918, but we all need to do our part. But if you want a historical perspective about where this can go, the 1918 flu pandemic, that is your historical perspective. And the CDC has a really helpful website that I put down there below in the link. I'm going to share these slides with you via Google Doc, so don't worry, you'll have all these resources. But the CDC does a nice job of talking about this particular pandemic. What is a public health emergency? this is what I talk about in my public health law class for an entire semester. It's basically something that is an emergency, and it has an impact on all of us. In the United States, we look at something called the utilitarian model, the good of the many versus the good of the few. And that's the way that we focus on public health emergencies in this country. Other countries use different models. That's what we use. Compulsory powers, this is what I mentioned before about what the government can do to make sure you stay in your home and why they can do that. And this includes all sorts of different coercive tactics, which, by the way, we shouldn't have to get to, because we should all be cognizant of the fact that if we had a loved one who was working somewhere and they had to work there, and I'm thinking particularly of the people who are some of the most on frontline people now are these poor people that have to deal with 85 million people coming into the supermarket now, trying to get whatever they're getting. Do you know supermarket workers are now really the frontline people? I mean, even before you see your doctor, people are running into Whole Foods. So before you do that, think seriously about what these individuals are having to deal with, what that looks like to that, and how we can all ameliorate things like that, because they're on the front lines now. Emergency powers the state can institute travel bans, suspending flights, evacuations, quarantines. We've seen some of these, we will see more of them. Can the government tell me to stay at home, not go to basketball game? Stop me from getting on the subway? Yes, yes, yes. And why should you care? Because public health is not just about your health, but it's about the health of all of us. We protect ourselves by protecting others, and we protect others by protecting ourselves. Federal powers and the health of the public. I might go into this on, you know, a little bit more detail, but essentially, this has to do with, this gets really sort of like nerding out with respect to what I teach. But basically, when we think about the powers of what the government can do, there's two main powers. So there's this thing that happened 150-ish years ago called the Civil War. And one of the things the Civil War told us is what the powers of the federal government and the powers of the state. And the vast majority of public health powers reside with the state, with our governors, and at the local level with our mayors, with our, council members. That's where it resides. Everything else that doesn't reside with them, which is a lot, resides with the federal government. So, if you think about President Trump and him making sort of announcements regarding travel and so forth, it's actually within his power to do that at a couple of levels. One is executive orders. He can make executive orders in times of crisis to do A, B, and C. People have been talking about the Stafford Act a little bit. He's within his right to do that. And then he's also within his right regarding several other federal powers. One is a Commerce Clause. So the Commerce Clause is essentially the way that the federal government can say to us, hello, individuals. We have the ability to make certain laws because of the Commerce Clause. And the Commerce Clause is basically interstate commerce. So that's the thing. The thing I always think about it with it, I use it in class. So let's say you're in New Jersey. I don't know why I always use kidnapping, but let's say you're in New Jersey, right? And you kidnap somebody and you're like, I know what I'm going to do. I'm going to take them to the Bronx and keep them there. Well, as soon as you decide to hop on the George Washington Bridge and get them to the Bronx, you know what you've done? You have now gone into the world of the federal government. And so when we think about how the federal government can get involved in our lives, a very clear way is the Commerce Clause. That person that kidnapped the person, now they want to cross state lines. Well, now they're in the world of federal land because now they've involved two states, New York and New Jersey. And the Port Authority, for example, it's a quasi-governmental entity, but it's that way. And oftentimes you'll see, the governors of Jersey and New York being involved in issues as it relates to the Port Authority because it's interstate, right? And you can deal with interstate commerce issues. So that's where the federal government can get involved from a public health perspective. Also, necessary and proper clause, which essentially is a catch-all for the government and allows the government to be able to get involved with respect to necessary and proper issues. And then taxing and spending. So I often say to my class, what can the federal government do? They can start a war. They can do things under the necessary and proper clause. Obviously, we've talked about the commerce clause. And then one thing that the federal government can do, they can tax you and they can spend your money. So that's general welfare. The Affordable Care Act is a good example of the federal government using its taxing and spending powers in order to create a federal healthcare law, which is a little unusual because usually that would be under the purview of the states. But for our purposes, yes, the federal government can do this. So the federal government can get involved in public health, but usually it's reserved for the states. Now, this case is called Jacobson v. Massachusetts. It's the case I basically based my class on, and it's a really interesting case. It's an old-timey case, 1905 case, 197 U.S. 11, and it involves a man. His name was Jacobson, and basically he refused to get vaccinated for smallpox. And the penalty for him not getting vaccinated was a $5 fine, which in our day would probably be about $100. The authority for the state to do this is something called police power. And that doesn't actually have to do with police officers, but it has to do with the state. And by this, I'm going to basically be referring to localities and, a state having the ability to protect the health of the public. Now, Jacobson is an interesting case because it's a civil liberty case. So it juxtaposes the rights of an individual versus the rights of the public. And Jacobson's argument was, well, hey, I'm a free human being. I should be able to live my life free and unencumbered from the state trespassing on my ability to live my life. And there's lots of other cases that do that. There's a case I teach called Davis v. Davis, which is a super interesting in vitro fertility case about people's ability to have children. So the government actually gets involved a lot in our ability to have autonomy over our bodies, with the government essentially saying you get to do what you want with yourself until it has large impacts on other people. And that's where the government's right to be able to do things like compel people to stay at home during these kind of issues comes into play. And so the states and localities have the power to be able to have you stay at home, have you not go out, have you to be able to be on lockdown. And that is all comes from this Jacobson v. Massachusetts case. And so when you think about why does the state have the ability to do this, why does the federal government have the ability to do this, think Jacobson and think things like the Commerce Clause. So that's sort of a Public Health 101 law class for you guys. Now you're probably of the 1% experts in the country on Jacobson v. Massachusetts. Why does the state care? They care because they want to protect you. They care because they want to advance their interests, which include you being healthy. And they care because, unfortunately, some people can't be told. So some people can't protect themselves from their own poor decisions. And so the state needs to step in and say, hello, person who's making poor decisions. We're going to help you make better decisions by doing X, Y, and Z for you, because clearly you cannot make those decisions. So that's about what I wanted to talk to you about today. Future webinar topics that I thought about include more myths debunked, life after coronavirus. That's a hopeful topic, and I think we should be thinking about that. What does a quarantine really look like? I mean, for example, if you are told to stay at home and you are not symptomatic, what does that look like? And then if you become symptomatic, what should you do in your household? I mean, if you live with 4 other people, should everybody in the household be taking care of you? No, they shouldn't. So somebody should be designated to basically take care of you. And then there should be procedures in place whereby you essentially are localized to one room, and that is your room, and you stay there. And then the person that's designated to help you takes care of you, and the other people, unfortunately, kind of try to stay away from you. So thinking about what that looks like practically and how you should function if you are in a quarantine situation, but then if you move to isolation, and remember, you guys are never going to forget how to use those terms again. I know you won't. So quarantine versus isolation. What does this mean for your family? When can I go back to my regular activities? When can I go back to seeing my friends and playing cards and going to baseball games? We'll talk about that if you'd like. And then other topics, which you can email to me at hmbutts@aol.com. These are references for you. I have more, and I actually sent my wonderful friends at New York City Football Club more. And I wanted to, just before I open up the lines, I just wanted to take a moment to give a huge shout out and thank you to everybody at New York City Football Club. They are the reason why we are doing this webinar today. They are fabulous. They're awesome. They're incredible. I do my soccer program with them. We've been friends for several years, and I wouldn't be able to do the work that I do with respect to soccer without them. They've been extremely proactive, is the word I would use, during this crisis. And they are to be commended for pulling this together, as well as being supportive of the coaches and the staff and the administration. So I just wanted to thank them. And I sent them this PowerPoint via Google Docs, and I'm happy to share it with anybody. If you want to email me at my old-timey email, don't judge, hmbutts@aol.com. And so now I think I will open it up to questions. So I'm going to try and unmute as many of you as I can. And yeah, if you want to stay muted, then just let me know and I can remute you. But for now, I'm going to start to take you guys off unmute. Okay, here we go. Okay, everybody's unmuted at this point. So does anybody have any questions for me? Any questions?
I do, Heather.
Hi, who's this?
It's Roxanne from Staten Island.
Yeah, hey, how are you?
I'm good. Since I'm kicking this off, let me just say this was so wonderful, helpful,
Thank you.
informative. So thank you so much for doing this. My biggest concerns right now are, what are the government's and the state's responsibility to ensure voting in the primary that's coming up in New York?
Right.
And what can we expect of them? What kind of pressure can we put on them? Because of this public health concern, people are not going to be able to come to the polling places in April or leading up to April.
Right. So this is going to be a huge issue. So I don't know if anybody remembers the day of 9/11. And I say this to people, and people are always like, no, this wasn't thing. I was like, no, it was. When 9/11 happened, that was primary day in New York. And the reason why I wasn't in the city sooner than I was is because I was late getting to work. I was just running late. I told my boss. But I was late getting to work because I was voting that day. And so we're going to have to really sort of think through some of these things. I mean, this is where I really put my public health hat on, because I know we all have lots. I run a nonprofit, right? So we all have concerns about things like, how will kids get fed? And like you just said, like, how will we vote and so forth. But I think we have to first we don't really have a real sense of the scope of this problem. And again, I don't mean to be gloomy and doomy about it, but I think when we really start to broadly test people, the sheer volume of individuals who are ill is going to be decently stunning. And at that point, then we're going to have like something else to sort of think about. So I would say, first, we just need to get a real scope of the landscape and really sort of understand how many people are ill, how ill are they, how can we care for them, how can the system sort of deal with this, and then sort of think through some of these other issues. I was even thinking about, something like jury duty, like how's that, how is jury duty going to happen in another 2 months? I think it's going to be a decently challenging issue. So I think we're going to have to be nimble, but I think people like yourself asking those questions is critical and paramount. In order for us to really sort of start to think through it, we have to be forward thinking in terms of what some of this is going to look like. So I think that's to be determined. And I would actually say that's a great webinar topic for the future in terms of things like that, like jury duty, like shopping, sort of in real time, living through some of this and what this will look like. So I'm happy to add that to the list of possible future topics. Any other questions?
Shamari asked, what are recommendations for travel this week?
Well, it depends on how you're traveling, right? And where you're trying to get to. I mean, a lot of this too is going to depend on what the government is enacting. So, I mean, again, this is one of those like myth busters. I mean, somebody yesterday said to me, "Oh yeah, did you hear the subway shutting down?" And I'm like, really? When did that happen? Oh, it's happening today. Is it? That's really interesting. So, and then, you come to find out, well, there probably will be some changes in the subway system. But in terms of, how people are going to get around, a lot of that is going to be dictated on what what is still available and how it is available for people to travel, what that looks like, and then where you're going, right? So if the vast majority of things are shut down and people are working remotely, and Broadway's done, and the opera's done, and sporting events are done, then I guess my secondary question would be, where are people going to travel to? Now, maybe that they're going to see a sick relative, so then that might be something that you want to talk with the hospital about. Should I even be visiting? Going to see somebody in a nursing home right now is probably not the most advisable thing one can do. And so are you a vector, and have you been in contact with somebody whereby doing that would not be advisable? So these are all things that we would think about. I guess the big question I would have would legit just be, where are you going? And why are you going there? And do you have to be there? And for some people, they do. If you're a nurse, if you're a doctor, if you're working at Price Chopper or ShopRite, apparently, yeah, you're on the front line these days, so you kind of have to be there. But if not, then I think it behooves all of us to have a serious conversation with those that we are interacting with and figure out if we actually really need to be going to the places that we're going, and if so, how we're going to actually get there.
He also mentioned the group chat. He's actually going to Trinidad.
Going to Trinidad? Okay, so I'll answer this the way I answered a student of mine. So a student of mine 3 weeks ago. So just don't do hindsight. Just do 3 weeks ago what we knew. A student of mine 3 weeks ago at St. John's seriously asked me after class, I have tickets to Italy for Friday. Should I go? And my response was, if you go to Italy now, and remember, this was actually, I mean, things are happening so quickly. I think it's hard to remember that 4 weeks ago, Italy was not in the situation it's in now. When he was planning on traveling, Italy was having a coronavirus outbreak, I would say, but certainly it was not what it is now. And so my response to him was, you can go to Italy, but if I were you, I would be prepared that when I come back from Italy, there's a decent chance that a week and a half, when you're from now, which is when you would be coming back, you will be told to be under quarantine for 14 days. Now, when he wanted to go was spring break for my university. And so he would have been okay for spring break because he didn't have class, but then he would have basically been under a quarantine. This was just my opinion. We knew none of this at this point. He would have been under a quarantine for 14 days. So I said to him, if you're okay with being under a quarantine for 14 days when you touch down back in the United States, which means you'd miss my class, you'd miss all your classes and so forth, and you want to take your chances given what the world is looking like right now, what I suspect will happen, I mean, I guess you could travel, but I highly suspect that one or two things is going to happen to you. You're either going to come back here and be under quarantine, or you're going to get stuck in Italy and you won't be able to leave. And his response was, I will take that under advisement. And he decided not to go. The very next day was when Italy announced the uptick in their situation, and then the United States raised the homeland security levels for that country. So my response to anybody that wants to travel anywhere would be the same as what I told that student, which would be, we don't know what the world is going to look like in another couple of weeks. And if you're okay with the possibility of being stuck in another country, I mean, it could, again, if the United States basically is now starting to close down people coming back here. Even if you're an American citizen, right now you can, but we really don't know what things will look like in another week or two. So I would be concerned about being able to get back in this country. If that is not a concern to you, then that's fine. But beyond just the concern about actually getting COVID-19, which I'd be concerned about, I'd be concerned that I would be stuck in a country for the foreseeable future. So that would be my concern. Anybody have any other questions?
Hi, this is Sarah Bloss. I have, I guess, a two-part question.
Sure.
First of all, this webinar is really robust and has been really informative, and I'm looking forward to some more webinars with the topics that you discussed. So thank you so much.
Sure.
So my question is, in looking at the data we have from the other countries that have been impacted by COVID-19, is there a projected timeline? And if so, and I know there's a lot of variables here, how can we expect that that's going to impact our education system with regard to our children?
Right. Okay. So the 1918 pandemic is a decent it's a decent guide for us. It's not fabulous, it's not exact, but I guess for some reason people think that, like, okay, COVID-19 is going to sweep through my country and then it's going to do what it does and it's going to move on to the next country. But that's not really how pandemics work, and that's not really how diseases work. So if you look at 1918, there were several waves of the outbreaks, the pandemic, that happened in countries. And it was, there'd be something in October, then there'd be something in February, then there'd be something in, June. So the actual trajectory of that time lasted for well over a year, maybe more. And at that time, you had certain countries that had multiple outbreaks. So my response to that would be, you need to sort of, I would say people need to assume that, like China, for example, let's hope that things are really sort of flattening out for them, and that they will continue to go in a positive direction. But there's nothing to say months from now there won't be another wave of illnesses. And so I think we need to all be cognizant of that and just assume this will go in waves, and there will be different waves for different countries. And even if a country gets one wave, they may have another wave just over the horizon. This is going to be with us, I would say, for a decent amount of time. I'm not saying not weeks, not months, longer than that. In terms of the sort of aftermath, the ramifications, and then sort of getting, quote unquote, getting back to normal, which I think normal will look very different in the future. But in terms of sort of what this will look like, I think months into, I would say, think to 2021 in terms of all of the ramifications of this, and then think waves of outbreaks and waves. So then for education, I mean, as somebody who now is teaching all of my classes online, it's a decently daunting prospect to think of what that will look like in terms of the future of education in this country. And so I think that, there's going to have to be a certain level of nimbleness in terms of how educational systems function. And I would say people need to become really familiar with various forms of online education, which is difficult for me to say as somebody who is nonprofit for underserved youth. And I know a lot of my youth don't necessarily have access to online education and training, but then that's why we all have to band together as a community to support people and hunker down in our own like little bubbles of isolation. We have to help other people because there will be people who won't be able to help themselves. Any other questions? Anything else? Going once, going twice.
I think I have another question if I could. It's Roxanne again.
Oh, yeah, of course.
Heather, I'm trying to understand what was the responsibility between state and federal government with mandatory test kits? Whose job was it to make sure we were all tested in the model of like other countries that have done like massive amounts of testing?
Sure.
So whose responsibility was it and where did we go wrong?
Okay, so I would say the first level of responsibility for a public health crisis starts with a state. It starts there. It has to, because that's what states are charged with. So, like our governor in New York, Governor Cuomo, who I feel like is actually doing a very interesting job of trying to at least get, it's a little bit of a catch-up game for everybody. And I think there was just a lot of denial. But in terms of that, I see a lot of updates from him and his people and so forth. So, there's definitely attempts there, but it starts with the state. So, I mean, I'm not going to jump on the like federal government bandwagon of, oh, they they've gone totally sideways and wrong. Because public health at its essence, at its nascent, starts with our states and our localities. That's the Jacobson case. The Jacobson case was Cambridge, Massachusetts, not even a state at the beginning of it. It was the town of Cambridge, and Cambridge specifically enacted an ordinance to help stem the tide of smallpox in the 1890s. So it starts with the states, right? But then as you have something that grows and grows and becomes something at the pandemic level, and then you start to be concerned about the multi-state responses, or maybe sort of the lack of response, then coordinated efforts need to sort of go into place, which is what you're seeing now. And so then at that point, you essentially have to have the federal government step in, because 50 states are never going to be able to coordinate in the same way. And if you notice, each state is doing something completely different. I've been watching Ohio with a lot of interest in terms of what they're doing. It's really interesting to watch them. But Ohio is doing things very differently than Texas, which is doing things very differently than New York. So each of the states are doing things very differently. And at a certain point, the federal government essentially almost has to step in. And then, as I mentioned, the ways that they can do that, the Commerce Clause is the most obvious way because that's interstate commerce. And so that allows for that. But executive orders are definitely obviously a way to do that. So I kind of don't want to necessarily assign blame and say like these people didn't do what they needed to do, this person didn't do what they needed to do, because something along these lines of a catastrophic pandemic, it's just really hard for people to wrap their heads around. I mean, I even see people now when I talk to them about it, and there's still people that are kind of like, like, it's not a big deal. Like, I'm just going to go live my best life and sort of like do my thing. So, trying to sort of rein in a public that's not completely on board necessarily with the catastrophic nature of this, that's challenging for leaders, right? But I think hopefully now we're going to start to have a little bit more a little bit more unity between the feds and the states and the localities in terms of what needs to be done. But the in terms of who has the most sort of like amount of power, the states have the lion's share, and that was done intentionally post Civil War in terms of what those powers would look like, to make sure that states could protect their citizens in the way that they felt that they needed to be protected. Because again, what you need in Texas and what you need in California, it's going to be very different than what you need in Wyoming, and governors should have the ability to be able to have oversight over that. But hopefully the efforts will become more coordinated, because we need them to be, as a nation. Any
Hi,
other?
Heather.
Yes?
Um, so I was on the phone with my grandma last night,
Yeah.
and she was on me about wearing masks. And I was like, Grandma, like, other people need the masks more. She's
Yes.
like, yeah, you should carry one or two around with you. You never know if you're on the train and someone coughs. I'm like, what if they just cough because they smelled something spicy, Grandma? Like, it's okay. So what are, like, do I need to be carrying masks around with me,
No.
or should I leave that for the healthcare professionals and people who need it?
Right.
And what are the advantages or disadvantages of me, a healthy person, buying masks?
Okay, so the issue with masks is so interesting to me. The mask issue is twofold. So one, unless your mask covers your entire body and you're wearing some sort of like bubble mask, it's not really going to help you, because remember, the virus is microscopic, and it can, the main way that people are getting ill, which is why you see everybody doing like elbow bumps and waving at each other and doing smoke signals or whatever, is by handshaking, right? You know, shaking somebody's hand and then they didn't wash their hand and you didn't wash your hand and now you touch your face and so forth. So masks are not going to help you in that way, because there's lots of other porous ways that you can get the disease. Now, if you are symptomatic, or if you are coughing for some other reason, yes, please, by all means, wear a mask, because then you will stop yourself from getting droplets on other people. But in terms of the mask being helpful for you, there's so many other ways that you can actually get the disease. It's not super going to help unless you wear like one of those industrial masks, like the people in the hospital are wearing, and FYI, they need them. So, you know, I would say no to that. And, you know, I can understand that your grandmother is very concerned. You're a lovely person, so I'd be concerned if something happened to you as well. But, you
Thank
know,
you.
yeah, but I would say that, you know, instead of that, the hand washing is the most important thing. And remember, and I know this sounds like wild, but when you wear a mask, usually it's not comfortable. So people end up fiddling with masks. So one thing that you need to think about if you wear a mask is, unless you're constantly washing your hands after you put the mask on, you have a better chance of probably infecting yourself by wearing the mask than not, because you're going to keep fiddling with the mask to make sure it's on correctly. And I know that sounds wild, but it's kind of a thing. So in order to not fiddle with the mask, to infect yourself, because your hands are probably not clean every time you fiddle with the mask, so then you're going to infect yourself fiddling with the mask, because you got to put the mask on, you got to fiddle with it. Now you're touching your nose and you're touching your mouth and you're touching your face. It's probably best to avoid the mask so you don't fiddle with the mask, and then you don't infect yourself because now your hands are not clean and you're fiddling with the mask. It's at the height of irony, I know, but that's a probably decent way to get infected, is wearing the mask and fiddling with it.
Wow.
Yeah, I know. Yeah, it's wrap your head around that one. Mm-hmm. Any other questions?
Linda asked, can state or federal government regulate the price of hand sanitizer so people are
Yes.
at in small stores, not
Yeah. The New York State's already actually working on that, and there are all sorts of consumer protection and price gouging laws. If I hadn't done the health law and like elder law, I was going to be the next great thing in consumer protection. So there's all sorts of consumer protection laws around price gouging. So there's apps, and I can send you information about that to get information out there regarding avoiding that. And if you see it, you can report it. And so, yes, that Governor Cuomo has specifically talked about that. And so if you see it happening, it should be reported, and the entity that's doing it will be dealt with. Any other questions? And this doesn't have to be the last. Like I said, I would welcome suggestions for future webinars. So if you found this helpful, which I hope you did, otherwise I'll just go away. But hopefully you found it helpful. In which case, then let's do more of these on a regular basis, and we can come up with more questions and talk about next steps and figure out how we can be helpful. The thing I would leave you with is, and I think, like, perhaps your story about your grandmother is very telling, because people want to be helpful during this time period, and they don't want to be alone. And so I think as we start to hunker down more and more, and we more isolate, we have to remember people who are older, who are sick, who are ill. Public health is an interesting thing because it wants to make sure that we protect everyone if people are sick, but that also goes for our mental health well-being and making sure that we take care of others. And so I would just sort of beg everybody on the phone call, don't get so caught up in your own need to isolate that you forget about other people out there. And there's ways to be helpful that you can stay healthy. It doesn't mean you're like, out in the street running around, exposing yourself. But that might be a nice call to have too, to think about ways that we can be helpful to our fellow citizens, where we stay safe, but people are not isolated and they don't feel super alone, and they don't feel like they're just out there by themselves, because there is going to be an end to this. It will be. And so on the back end, we need to make sure that we have maintained our social connections with other people, that we're kind to each other, and that we can go forward with a level of dignity and civility that will be meaning for all of us. Any other questions?
No, I also, this is Emily.
Hey.
On the the city employee side, I think I just want to say that I know the leadership team on my side has been every day taking it one day at a time, figuring out protocols, what happens next, and they've been on calls with the governor's office, with all the other DA's office, with the mayor's office, with NYPD, and so I want to say, as a city, this is something that's they don't really know how to handle this. And so I know that there's a lot of questions, and there's a lot of I guess anxiety on our end, and on all of our partners. And I just want to reassure people that these conversations are happening, and it's fairly new, and they don't know how to handle it. And so I know there's a lot of pressure for DOE to shut down. There's a lot of pressure on us with you mentioned before, jury duty. And so these are a lot of things that I think whatever happens tomorrow, whatever happens Monday, a lot of things can change from now. And so I just think that I think, like you said before, just working together collaboratively, but also social distancing. I think the city is just trying to figure out the best way to handle this without causing chaos right now.
Yes, and Emily is from the DA's office in Manhattan, and another amazing, fabulous partner that we've worked with, who I want to thank you for all your help and your support. And she's absolutely right. I mean, there's tons of conversations going on. I mean, I think one of the things that's it's sort of kind of overloading people a little bit is, I mean, I know my email box is now, every single email has COVID-19 somewhere in the in the subject line. So I think, lots and lots and lots of people are talking, and there's lots of discussion. And so I think, to the extent that we can, continue to have these kind of webinars where people feel like they have input and they have information, and people like Emily can hear this and get the information to other people, I think it's totally critical and wonderful. But there's a lot of people out there that want to safeguard people's health. And specifically, that's what these entities are supposed to be doing. I mean, and I say this all the time, but, as myself, as a public health person, it's all good and well to be in public health where things are hunky-dory and fine and nice. But I mean, this is what I went to school for, and this is what I trained for. These kinds of situations where you really have an emergency. And so there's lots of people that are interested in making sure that people are protected and safeguarded. and we'll make sure that that happens. So I appreciate what Emily said, and she's absolutely right. And, it's just going to take a lot of work to coordinate all this and make sure that people get what they need to get in the ways they need to get it.
Thank you, Heather.
Oh, you're so welcome. Anybody else have any other questions before we sign off? Okay, so again, you guys have my email. I'm gonna get the actual slides to you and the recording. So this was recorded. Tom, make sure that everybody has the recording, and then just let me know if you'd like to do more of these. I'd like to, and I, would like to maybe sort of, invite other people on and have some other experts talking and so forth. So just brainstorm about what you think would make sense, and we can continue the conversation. Okay. Okay. Otherwise, I will sign off for now, all right?
Good.
Bye.
Thank
Bye,
you.
everybody. You're so welcome. Bye.
Thank you.
Okay, take
Thank
care.
you.
Bye.
Bye-bye.